Hey guys, as we promised, this is our video on type 2 diabetes mellitus. In this video, I'm going to try to explain to you guys some of the pathophysiology behind this disease, as well as some of the treatments that are currently available. So first of all, what is type 2 diabetes mellitus? Well, type 2 diabetes mellitus is a glucose metabolic disorder that is characterized by insulin resistance in the peripheral tissue. In the later stages of this disease, these patients might become totally insulin dependent because of beta cell failure. Type 2 diabetes mellitus also has an insidious onset. This is in direct contrast to type 1 diabetes mellitus that occurs very early in life. In our previous video, we talked about some of the acute side effects of diabetes mellitus. So here I'm not going to bother going through it again. I'm going to instead talk about the chronic effects of this disease. The chronic effects of this disease can basically be split in two major categories, either vascular or osmotic changes. The vascular pathologies associated with diabetes mellitus are caused by glycosylation processes that occur in the blood vessels. There's no need to go into too much detail at this level, but what you should know is high amounts of glucose in the blood will cause damage to the eyes, to the kidneys, to the larger blood vessels, to the coronary arteries, and can cause vascular occlusions leading to gangrene. You should also know that diabetes mellitus is the most common cause of renal dialysis and is also the most common cause of amputations outside of war. Another cause of chronic injuries caused by diabetes mellitus is due to osmotic changes that occur due to sorbitol accumulation in the tissues. Now again, I'm not going to go into too much detail, but you should know that sorbitol can accumulate in the eyes, causing cataracts, and also accumulate in our neurons, causing something called diabetic neuropathy. So, what are some of the treatments that are available for this disease? Well, before you give them any medication, you should always try to change their diet. But if that doesn't work, then the first line of treatment for type 2 diabetes mellitus are the biguanides, or metformin. Now, keep in mind that this is the only class of type 2 diabetic drug that has been proven to decrease cardiovascular events. So how do they work? Well, to be honest, we don't actually know how metformin works. We do, however, know that it acts on two major areas in the body, and that is the liver and the peripheral tissues. Now, I'm going to try to explain to you guys how you should be memorizing these drugs. You shouldn't do it randomly. Instead, you should try to visualize where in the body these drugs act on. So in this case, biguanides act on two primary areas in the body, namely the liver and the peripheral tissue. In the liver, this drug decreases gluconeogenesis and activates AMP-dependent kinase. AMP-dependent kinase is involved in glucose and fat metabolism. In the periphery, biguanides increase insulin sensitivity in adipose and muscle tissues and thereby increase glucose uptake. They also increase fatty acid oxidation. Now, I'm going to give you guys some tips on how you can memorize what this drug class does. If you take a look at name biguanides, you immediately think about the number 2. And that's exactly right, because biguanides act primarily on two parts of the body, the liver and the peripheral tissues. It also has an effect on the GI tract by decreasing glucose absorption, but this is not that important. You just have to know that it's there. The next drug class we're going to talk about are the thiazolidine dienes, or the glitazones. So what do? Well, they work primarily by activating PPAR gamma, which is something that's expressed primarily in the adipose tissue. As you probably imagine, this drug is going to increase lipogenesis, it's going to increase glucose uptake in the periphery, and it's going to reduce liver gluconeogenesis. And again, you can play around with the words in order to help you memorize what this drug class does. So, glitazone sounds like glucose alone, and that's exactly what glitazones do. They only affect glucose levels within the blood, which means they either increase glucose uptake in the periphery or they reduce liver gluconeogenesis. They have nothing to do with insulin levels, which involves the pancreas, or glucose absorption, which involves the GI tract. Something you should also keep in mind is the drug rosiglitazone. Rosiglitazones have apparently been shown to increase the risk of a cardiac failure and myocardial infarctions, and therefore there's been a lot of controversy as to whether this drug should be taken off the market. The next drug class we're going to talk about is sulfonylureas. These worked only on the pancreatic beta cells, and they work by closing the potassium channels and causing depolarization, and therefore resulting in insulin release. Something that you can use to help you memorize what this drug class does is to once again to play around with the words. If you take a look at some of the examples of the sulfonylureas, you'll realize that a lot of them end with amide. So what do amides do? Amides depolarize, and that's exactly what sulfonylureas do. But do keep in mind that this little study aid won't work with every single sulfonylurea drug, because not all of them end with amide. And also, there are other drug classes out there that have nothing to do with type 2 diabetes that also end with amides, so that won't work either. This little study aid is really meant for short-term memorization. Next drug class we're going to talk about are the meglitinides or the glinides. These drugs act on the exact same target as sulfonylureas, except they bind to a different site on the potassium channel. Moving on to gliptins. These drugs work by inhibiting an enzyme called dipeptidyl peptidase 4. DPP4 essentially cleaves incretin, and therefore if we can find a way to inhibit DPP4, then we can increase incretin levels within the body. For those of you who don't know what incretins do, incretins increase insulin levels within the blood before the glucose levels rise after a meal. They also reduce absorption of glucose by reducing gastric motility. And finally, we're going to be talking about alpha-glucosidase inhibitors. An example of this would be acarbose. The drugs within this class basically inhibit alpha-glucosidase and other intestinal enzymes that are necessary to break down polysaccharides and disaccharides into monosaccharides. If you remember from your GI physiology, you'll remember that only monosaccharides can enter the body, which means this drug is going to delay carbohydrate uptake. Alright, so that basically sums up the session on type 2 diabetes mellitus. I hope you found it useful. If you did find it useful, please don't forget to subscribe to our channel. Also, if you have any other questions, don't hesitate to post a comment below and we'll try to get back to you as soon as possible. In our next video, we'll be starting a new series on analgesics and anesthetics.